Hello, I'm Joan Justice from HealthWorks Collective, and I'm here at the mHealth Summit with Robert Herzog from eCaring, and Robert is going to talk to us about Care Manager and Care Tracker. Okay, Robert, tell us a little bit about your website there.
So eCaring itself is a comprehensive cloud-based system that generates behavioral and clinical data in real time from a patient's home or any residential setting. It is a unique way to capture enormous amounts of information. So this is our care tracker, which is the way in which a patient, a home aide, or a family or friend caregiver can enter all kinds of information about behaviors and clinical data. So here you can see that you can enter information about personal care. So if we go to now, at this hour, we can say, all right, somebody took a bath, somebody ate a meal or didn't eat a meal or refused their meal or refused something to drink. You can enter information about activities, exercise, watching TV, praying. We collect information about mental state and mood, the only system that does that. Toileting patterns, when people went or if they had accidents with that. Health information, such as did they take or refuse their medications? Are they in pain? How much pain are they in? And with that kind of information, we can set customizable alerts so that if somebody was in a certain level of pain, that would automatically trigger an alert to their caregiver, whether it was a family member or a care provider. You can see if they were sick, when did the fever start or their diarrhea start, etc. And then in addition to that, we have special problems such as if somebody fell or if they had slurred speech or anything like that. So that's comprehensive behavioral data to give you a feel of what's going on. But in addition, we also can enter clinical data. So if you have
vital signs, things like that.
Exactly. So if you have a cardio patient and you're really worried about their weight, then this is a super easy way in which you can enter information. All they need at home is a scale, an everyday ordinary scale, and you can enter this. The same would be true for if it was a diabetic and you wanted to enter their blood sugar reading, or if you wanted to capture blood pressure or temperature. So with this information, we generate this comprehensive picture about what's happening to a patient in their home in real time.
And it looks easy to use.
It's very easy to use. We've trained a lot of aides in this, many of whom English is not their first language, or they have no healthcare literacy, frankly, or even English literacy. And they never even used a computer before. So this is the way information is entered in our care tracker system. To view the information, we have the ability to track this by either a single family, tracking one family member, or a care management organization, such as a hospital, an accountable care organization, a medical home. And they can track their entire patient load, seeing all their patients. And by each patient, they can then view the information and see a comprehensive picture of everything that's going on in the home, so that you can see all of the basic information. I'm just going to get to the previous week where we have information.
And one is translated to the other? Is that the first?
It's automatically uploaded, that's right. So here's a comprehensive picture of this patient's life over the course of that week. You can see everything that happened, also the color coding makes it easy when they were sleeping, when did they eat, etc. And you don't, if you just want to see, okay, I just want to track their eating pattern, so you just see that. If I just want to see what their toileting pattern was, or did they have any special problems or not? When were their vital signs taken? You can break this data down.
It's customizable.
It's completely customizable, configurable. It can work on a PC or a Mac. It can work on an iPad or an Android tablet. And all of the icons that you see, you can select. So we have predetermined care plans, for example, here's a data set and information, a dashboard for congestive heart failure patients. We're working with a hospital that wants to reduce the readmission rate of those patients. So these are the critical data points: weight, shortness of breath, swelling. So if they enter that their shortness of breath is at a certain level, that will trigger an alert for the transitions nurse in the hospital, and she'll either call them, arrange a telehealth visit, a doctor's visit, or even get them to the ER, depending on the severity.
So you can prevent ER visits, repeat hospitalizations.
We want to keep people at home as long as possible, at low cost as possible. And the way to do that is if you can intervene early to keep small problems in the home from becoming big problems in the hospital, then you can have a tremendous impact on cost and quality of care for those patients.
Yeah, I think that looks great. I really
Thanks.
like the ease of use and the color coding. I mean, I understood it right away.
Well, that's good. It's important to say it's easy to use not just for entering the information, but for the people viewing the information.
Yeah.
You have to be take account for the workflow for the very busy physicians or nurses or care managers to make sure that they can use this really easily. That's why we create these customizable, configurable screens for alerts. You can set any kind of an alert you want. You can see any kind of data that you want, and therefore you can really comprehensively manage a patient in their home to keep them there longer at lower cost.
Thanks a lot, Robert.
My pleasure.